Hey everybody, welcome. I hope you're having a wonderful Friday. It is gorgeous here in South Carolina. I last week jumped on and answered a question that somebody had asked and said, hey, if you guys want me to answer some more questions, ask me questions in the comments. And people really liked the video, and I got a lot of encouragement to do another video or more, and I got a lot of questions. And so I want to take one of the questions that was from last week, and I'm going to answer it. And if you have a question for me, stick it in the comments, or if it's sort of a private thing, you can DM me on Instagram and just let me know what your question is. And I'm going to keep doing this, guys. I love talking to you, and it makes me so happy to talk to you guys and get some feedback in the comments and just hear from you. Like, it just, man, it fills my cup. All right. So I wanna try to fill your cup today. I got a question from the comments. And it said this: why do we have only unbearable jobs in our profession? I have worked at multiple practices in my career, and they were all toxic. Why is it so bad? All right, I'm gonna break this down now. All right, she's not asking me why practices tend to be toxic, and she's not asking me how to fix a toxic practice. That's really hard without more details. She's asking me, I've only worked at toxic practices. Why is that? And I want to talk about that because I think there's a lot of people who are like, yeah, everywhere I go is terrible. Let me talk about that a little bit. Before I tell you why I see people showing up or ending up again and again in bad practices, because there are bad practices and there are people who bounce from bad practice to bad practice. It absolutely happens. All right, before I talk about that, I have to take one thing off the table, right? And you guys watching probably know what this is. I got to say it. If you work at a bunch of different places and they're all terrible, there is one common denominator that on the outside, I don't know you, but there's one common denominator in this situation, and it is you. So if you're like, everywhere I go, all I deal with are a-holes, there's a common denominator in your interactions, and it's you. Maybe you need a snack. Maybe you need a rest. If you only work at terrible places, I got to say, I don't know you. You may be the most wonderful person ever, but I got to say, if again and again I'm unhappy, I got to look hard in the mirror and say, what am I doing here? Am I making this? Again, I'm going to assume that's not the case in this question, but I got to put forward and just say, hey, first thing I got to do is look in the mirror. Like, you guys know, that's just being honest. Okay, start with that. Take it off. I'm assuming that's not the case. All right, this is a wonderful person. They've had a number of crappy careers, right, or crappy jobs. Why does that happen? All right, so I got 6, 7 possibilities. Right, now, here we go. All right, number one, bad luck. There are bad places to work, and sometimes it's just bad luck. And I 100% know great people that just have their first job. It's not a good job, and they go somewhere else and they end up in another bad job, and they go somewhere else and it's good, and then things change. Remember, guys, culture waxes and wanes. And if you're in a great practice and you go, man, we used to get along so well, and we're not getting along so well right now, that's normal. That's okay, right? It can come back, right? Don't hold on forever, right? But know that team positivity, team culture, your enjoyment, your natural enjoyment, it goes down sometimes and it comes back up sometimes. It's okay to be happy. It's okay to be sad. Like, these things happen, and your team will pull together sometimes and they'll drift apart sometimes. And it's just normal. It's a normal ebb and flow. And so you may have come into a place that was good and then it turned bad and you're like, God, another bad place. It can 100% be bad luck. And maybe you're just not ending up in a good place. And we need to keep looking, because you don't want to stay in a toxic place. It doesn't have to be that way, right? So number one is bad luck. Number two, maybe there's something baked into vet medicine. And I say this again, I say this with love and compassion, but it's like, if you go to a bunch of different places, right, and they're all bad, at some point, I need you to look at vet medicine as a whole and just say, is there something baked into vet medicine that turns me off? That I don't like. And so I'll give you some examples of things that I see. And this is not bad. This is being honest about what you want and what engages you. And so I know people who just can't deal with euthanasia, right? They can't help but internalize that pain, that sorrow. It devastates them. You might have seen somebody like that. Actually, I'll ask in the comments real quick. Have you guys ever worked with someone who just really struggled with euthanasia and not just being so empathetic that they take that home? Because that's hard. And if that is you and you say, God, I can't be around this, it eats me up inside, you need to be honest about that. You need to take care of yourself, right? And you maybe say, this is not where I need to be. And that's not bad, right? There's other things that we can do or other places that we can look. But I don't like people. And I hear a lot of people saying, I do not like people. And I go, that's baked in to vet medicine. It just is. And, and there's not a practice you're going to go to that's the not people practice where pets show up with wallets strapped to them. Like it doesn't happen, And so what does that mean for you? It doesn't mean you're a bad person. It doesn't mean that you're a failure. It doesn't mean you're a wonderful caregiver. It just means that this is going to be hard for you wherever you go. And we're either going to have to figure workarounds around it, or we're going to have to find a place where you're not having to do those things that you don't like to do. There are some people who hate talking about money. And what I would say is, hey, if this is baked in as, hey, we do services and some people can't afford services and we have to carry that burden or work with those people, if that eats you alive, that's really hard. But I'm going to say that's baked in to medicine in a lot of ways. And you're going to have to really work to find a place that that's not true, because you'll keep moving around and around and you go, God, why am I unhappy? And if it's something that's just universal in vet medicine, it's just going to stay with you. And so I don't want you to, the biggest step of this is identifying and going, this is the thing that's baked into vet medicine that bothers me. Can I stay in vet medicine and minimize it or work around it, right? Is there something that you're carrying, right? Is there something that you're carrying? I have a friend, and she said, God, Andy, my job is awful. And I know her, and I know that she can't find reliable childcare. And I know that she's doing physical therapy for an injury. And I know that she's having some serious conflict with family members. And she talks about how awful her job is. And I can't help but wonder, like, hey, I'm not saying her job is good, right? I'm not saying that she's not wrong. But I think a lot of times, guys, there are things that we are carrying, right? There are burdens that we are carrying. And they sort of become invisible to us. And so we feel sadness, or we're exhausted, or we feel fatigued, or we feel angry or frustrated and things like that. And at some level inside our brain, we look around and we go, why do I feel this way? And then somebody at work goes, God, this sucks. And you go, yes, that sucks. And then we hang our anger or frustration on our job, which again, it's probably not perfect, and it may be bad. But a lot of times we are carrying all these things like, outside our lives and stuff like that. And they're true and they're honest, right? And they're real. And we hang them on our job and go, God, my job sucks. And the problem with that is we're not honoring ourselves and the true things that we're wrestling with and dealing with. And so we externalize them, we put them on this job. And the problem then is if I change jobs, all those other things come with me, right? You can't outrun burdens that are strapped to your back. And so, part of it is just going, God, I'm moving around and I'm still unhappy, or I really hate this. What's the full picture, right? Most of us are not defined by our job. We got so many other things going on in our lives. And so anyway, just sit with that for a second too and go, man, I've gone to these multiple places and I can't be happy here. What are the burdens that I'm carrying? You know what I mean? And even if there's not things I can necessarily fix, at least if I'm honest about what those burdens are, and with myself, and I find them, God, that's super helpful, right? Maybe, and I've seen this, maybe you're attracted to drama. And again, not everybody, definitely not everybody, but people who they're drawn like a moth to flame to drama. I see these people. I know them. They're like the vet techs at the bar, and the music is playing, and they look across the bar, and they go, Jessica, look at that practice. Look at the practice over there. And Jessica turns and looks, and you're like, yes. The one with the leather jacket and the tattoo on its face, that's the practice for me. And Jessica's like, no, don't do it. And you're like, oh yeah. Hey, big toxic boy, you want to get down with an LVT? And then it's straight down to Toxic Town you go. And I don't know why, but some of us, it is the drama. And we go, I don't want this, but then we're right in the middle of it. And so, are you attracted to drama? Because I swear to God, there are some people who are like, they're in a practice, they're not happy because of drama, and then they go out and they look at other jobs and they just go straight to the most dramatic other place that they can find. And so, are you attracted to drama? Is this something that we need to check out? Maybe we just go get yourself a nice practice boy or practice girl who's going to treat you well. Just go find that person and settle down. Don't go for the drama person. Don't go for this snake hammer animal hospital. Those guys that's a bad crowd. Don't go for them. And the last thing is, and I just got to ask, as I see people who wrestle with these things again and again, and they go to a toxic place, another toxic place, another toxic place. And please know this comes from a place of love, but I just got to ask, are you going to practices that are not good or not good for you because you don't think that you deserve better? Are you going to places that are not what you want to do because for some reason you don't think you deserve to go to the place you want to go? Do you think that you go to a practice that doesn't practice the medicine that you think is fascinating and inspiring because you don't think you're smart enough? Or you don't go to the place that treats their technicians with respect because you don't think you deserve that respect? I think some of us have that thought, and a lot of us wrestle with feeling like we're not good enough or we don't deserve better than what we get. And I see that a lot, and I see that a lot in my support staff, and it breaks my heart. And I just want to say to you, think about it. And if that's true, if you're not going where you want to go, where you're going to be happy because you think that you don't deserve to be happy, or you don't think that you're going to fit in there, no, that's not right, my friend, my dear friend. No, that's not okay, right? You can be what you want to be, and you can go and become what you want to become, and you can learn what you need to learn, and you do deserve to be happy, and you do deserve to be treated with respect. You do. And so if you're having those thoughts and you're working in a place you don't like, and another place you don't like, and another place you don't like, again, I just want you to think about this, because you do deserve to be in a good place. And so anyway, those are the big ones that I see when I see people show up again and again and again in crappy places. And like I said, sometimes it's just bad luck, and so don't think it's not. But there's a lot of other stuff. There's things baked in. We're carrying burdens that we don't maybe necessarily even realize. Some of us just we like excitement, and that excitement really manifests as drama, and we end up going from a drama factory to another drama factory. And the last is, for some reason, some of us don't think we deserve to be happy or to be treated with respect. I'm like, there's no damn reason for you to work in a practice where the doctor yells and throws stuff. Like, it shouldn't happen. You deserve better than that. Period. You do. So anyway, guys, I hope that that's helpful. Somebody out there who's looking around going, what am I going to do? I just saw my dog. That just so you know, I'm not at the vet clinic. If someone's like, there's an unleashed dog wandering around your vet clinic, that's not true. That's Skipper. That's Skipper Rourke. I'm not going to call to him because he won't come, and then I'll be embarrassed in front of all of you, and you'll be like, he's the vet whose dog doesn't listen to him. He listens to me when you're not here. But I know him well enough to know that in public, in front of 150 people watching this, he's going to totally run the other direction if I call him. Anyway, all right, guys, I'm going to wrangle this bad dog up. I got to get my lunch. I hope you are having a wonderful Friday. Let me know, again, if you like these videos, let me know. Give me a pat on the back. Say, yes, Andy, keep doing these. Here's a question for you. I'm happy to go to the mailbag and do that. All right, take care, guys. Have a wonderful, wonderful weekend. Bye-bye.